other chil- for other children that have challenges with the way their brain processes. Maybe there's a delay, or they behave differently. They are neurodivergent, and so they need to be considered. So such individuals are looked upon differently, and especially children. They're looked at differently from when they're interacting with other children, whether at school, whether at play, whether even at home. Maybe they have neighbors. Um, okay, um, so that's what neurodivergent is. And then I believe that all of us on the platform, we work with children with additional needs or special needs. The latest term is additional needs. And then we work with them in terms of helping them uh, with functioning. So when we are working with them to help them to function, then we have to be mindful of how they are able to relate with people, in terms of how they're able to communicate with other people. So social skills is going to focus majorly on their ability to communicate, and then non-verbally and verbally. So the for instance, neurotypical children are this kind of skills that they have. They are able to communicate. They're able to um, sympathize, empathize. So I also want to focus a bit on pro-social skill behavior. In terms of if you have neurodivergent children or even teenagers or probably adults, uh, how then are they able to integrate within their own space, their community, the school they go to, um, how they relate within the area where they live. So that means that social skill is very, very important. One of the things I would like to talk about will be their self awareness and acceptance of themselves. So you have a child that has a communication, is not able to speak on time, has a delayed speech, or is not even able to speak at all. And then, you know, where they live or in school, um, they are not really able to relate with the other children, or even the other children might also be neurodivergent or have additional needs. And then we want to begin to teach them how they are able to communicate, they are able to use words for those that are already speaking, or maybe they don't have clear speech, or they have delayed speech, and then they are learning to use words. So we want to begin to be able to teach them with how they are able to become aware of their environment. They're able to identify objects. They're able to maybe point at an object. And then for those that are already speaking or using one word, two words, they're able to say something, maybe call a name, maybe identify an object, maybe being able to even take their caregiver or their teacher to take them to a place or to something they need. They want to. So that is one of the things that we want to start teaching them to do. So, um, so we have to first be able to help them know that, oh, maybe identify an object, then build a story around that thing we want to teach them. We want to teach them how to, maybe, for instance, be able to pack their toys or even arrange their toys. So we have to start to begin to teach them, oh, okay, maybe if the 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 toys have cars, it has balls, it has, so for them to even be able to identify, oh, this is a ball, this, to know ball, to know, probably also know car, to be able to identify colors. So they gradually become socially aware that way. And then that helps them to be able to um, accept their own person, first of all, before they are able even to relate with other people that are around them. Um, so communication is a very strong thing that we will then have to help them with, in terms of focusing on how they can become empathic. They are able to know that, oh, if they do something that will make, maybe if they uh, hit another person that is another child that is around them, that it's not good enough. It's something that, oh, okay, maybe they want, the other child wants to pick a toy that they're playing with, and they, become a bit aggressive and all of that, to let them know that, okay, being aggressive is not right. Oh, okay, that, okay, you have to learn to share. You have to, so maybe you want to encourage them to give the toy by themselves to another child if they have more than one, so that they show that form of empathy, and they know that, oh, they can share um, their toys with another child, rather than react in a, in a aggressive, or in a way that will not show that they are kind to another child. So those are some of the things I think that would also help, in terms of helping them build social skills. Being able to say um, the magic words that we teach children generally, or when children are growing, we teach them to say thank you, to say please, to say um, uh, what are the other ones? Just to be able to be kind to people, to know how to um, relate in a good way. Uh, so that is another thing that I think, in terms of social skills, that is important. Uh, we also have to begin to teach how to set boundaries, to know that, oh, okay. So you have children that, oh, they, at times, maybe when you are working with them, they already know how you relate with them. So at times they want to test how far they can go, what they can do and get away with which even a neurotypical child will do with their parent or their caregiver. They know that, oh, okay. For instance, if a child knows that, oh, if I cry, or you're, maybe a child, a 7-year-old knows that, oh, if I cry, mommy will give me this. Or if I do this, I'm able to get away with some of the things that mommy has said no to. So we have to start teaching them boundaries. We say no, no means no. So to also help them be able to know that, oh, okay, what, when I say no, I mean no. So if, for instance, if it is pack up time, when playtime is over and they're supposed to pack, and then a child is not packing and then begins to throw tantrums, we have to learn to be able to um, be firm in terms of making sure that they are able to respond to that activity that we have set out, that, oh, okay, now it's pack up time. Oh, playtime is 9 a.m. Oh, okay, by the time it is 10, it's pack up time. So they know that, oh, okay, playtime. They also know, oh, pack up time. So when a child is throwing tantrum at the time when it is pack up time, oh, okay, it's time to say, oh, it's pack up time. And then if the child is, oh, okay, you can then, oh, okay, if you don't pack up now, that means you might not get the opportunity to play with this toys the next time. So they need to begin to understand that there are boundaries, and it can go in other activities, not only maybe when they're playing, it also might be when they are being given instructions as to doing something, and then so they are able to also um, obey the instruction. They know that, oh, okay, if I obey an instruction, maybe that instruction that they obey, it is tied to um, a reward, or it might also mean that, okay, they are building, tokens that would help them have access to more playtime if they obey the instructions. So it will be good to begin to set boundaries, to begin to let our children know that there are boundaries when they are doing things. It helps them to also be able to obey instructions where they are not, even with their caregivers alone, maybe when they're in school, maybe when they're in a social space where they are relating with other children. That would also begin to help them to know that, okay, they have to adhere to instruction or comport themselves in whatever environment that they find themselves. So another thing that I think is also important is for them to understand that, for people that are neurodivergent, you also need to um, begin to teach, because some of them can have communication problem. They are having, some might have delayed speech, some might not even have speech at all. So we must be able to um, teach them non-verbal cues, language, in terms of helping them to be able to relate with what is going on within the environment. So, for instance, if a child needs something, and then because the child cannot speak, he or she probably would cry, and then to get the attention of the caregiver or the parent or the person that is around them. So to be able to identify, oh, okay, if this child is crying, or maybe the child comes to the caregiver or the parent to tap them to, or take point at something, to be able to know that, oh, okay, what does that mean when the child points at maybe a toy or points at a water dispenser to say, oh, maybe he wants to drink water, or the child is touching his or short or panties, to know that, okay, maybe they want to use the bathroom. So these are things that we need to use. So that's still part of, making them become aware of themselves, making them become aware of the environments in which they are, and also how they can relate with other people within their space. So that's another thing I think would help. Another thing that I also think would also help in terms of social skill will be um, also giving neurodivergent individuals opportunity to also relate, in terms of maybe being in social spaces where you have neurotypical children, teenager, so that they also are able to interact with them and see some of the things um, that is not usually common with them. It helps them to be able to be more socially aware in their community, outside of maybe their safe space, which might be their home, which might be when they're with their caregiver, helping them relate with social spaces where you have neurotypical individuals would also help them become more inclusive, in terms of also trying to do the activities that other children that don't have um, the same kind of challenges they are experiencing. Uh, so they maybe in social space where where a play area where other children also have access to, where they also can begin to also see how they can relate within the community and be able to do other activities away from the ones that they, especially the one that they are used to. So those are some of the things that I believe that if we begin to expose and begin to help our neurodivergent children and adolescents to engage in, it would also, or we are exposing them to, would also help them to learn to become self-aware, to be more socially accepted or more socially inclusive. But they need to begin to learn these social skills, and it will help them become better individuals as they interact with their environment, interact with other people within the community and within their own space and influence. Um, thank you very much.
Thank you so very much, Mr. Okeowo, for that wonderful short talk on improving social skills in neurodivergent individuals. Thank you once again. Yeah, yes,
Thank you, Dr. David.
I heard you mention what will I can say that from what you have said, it looks like it's a teamwork. And I'll say that some other team members are involved. For example, we might need the help of a speech therapist, we might need an occupational
Yeah.
therapist, behavioral analyst, psychologist, and so on and so forth. But
Yes,
there's
Dr.
this
David.
question that I would like you to buttress on. So we'd see that many of the times when these kids comes to our clinic or they come for assessment or you meet them outside the hospital environment, many of the times you see them carrying their tablets, and they are so carried away with what they are doing on the tablets. If I may ask, can you talk more on the role of technology and use of apps for
Oh, okay.
adventure, the positive, the negatives? I mean, sometimes we hear about, as much as possible, reduce screen time to not more than two
Exactly.
hours in a day. But again, yeah, we cannot totally say that this technology does not have its own advantages. So I want you to talk a little on that. To what extent? I mean, what are the pluses? What are the minuses? Is it a good thing? Is it something you want to advise, you want to encourage, and all of that, please? Thank you.
Thank you, Dr. David. Um, technology, the role of technology, if well, used, would also help a neurodivergent individual. First of all, we cannot run away from the fact that the generation where we are now, they are technology enabled. So that is something that we can't run away from. So you notice that people before now would maybe for screen time play DVD players for at home and all of that for their children or family. But now you have more of tablets, you have phones, you have all of that taking over, you know, having to get home before you can watch. So it then makes it something, it's more like everywhere you go, like MTN, buy like, the technology goes with you everywhere. So I think it's very important that we need to be very mindful of screen time with neurodivergent individuals. Uh, just like you said, when these children come to the clinic, you see that they're carried away with the tablets or the phones that they are with. And then one of the things that I've observed is that it's always more of something that is being used as a um, way of the respite for the parent or the caregiver, just to for the child to leave them alone for a bit
Mhm.
and all of that.
Mhm.
So that they have a bit of succor away from maybe the attention seeking behavior and all of that. That can be counterproductive if giving them tablets and all of that is just so that you can get some time away from um, whatever thing that they are doing, or maybe they are throwing tantrums or trying to seek attention. It would be nice to be able to focus on what the challenge is so that you can help the child know, like I was talking about setting boundaries. It can be a way to set boundaries. It can be a way to um, also reward the child in terms of, oh, okay, if you are able to do this, if you're able to sit quietly or not, you know, throw tantrums for some time, then you will get your tablet and then you are able to play with it. So it's a way that we can use the technology that we have to our advantage, but not just as a opportunity for let me just leave this child for a while, and then the child just goes off like that. So technology is good, but it needs to be controlled. And screen time is important. Caregivers and parents have to set screen time, even for neurotypical children that do not have challenges with all these things. They also even need um, to have boundaries. Then to talk about our children that have additional needs. So it's important that technology can be used in a way that will support what we're trying to achieve in behavior modification, in terms of helping them to learn social skills and other things, in terms of their growth and development. So screen time is very important and we need to regulate it. And then we should also, um, while also allowing them to learn some skills using technology, we should not just use um, the negative side of, oh, okay, let me just give this child so that I can allow me rest, and all of that. That will not allow us to set boundaries. And then the child that we were looking at, that you think is neurodivergent, that has additional needs, it then doesn't mean that they in other areas where they're growing, for instance, if they're at adolescent stage, they will also go through the puberty stage. So the other areas of growth in their lives is not being taken away. So they also can try to manipulate their parents, just like a neurotypical child would do, when they know that, oh, this is the way I can get something from my mom or dad or the caregiver. So I think that is what I would say regarding that.
Hmm. Thank you so very much, Mr. Okeowo. So the floor is open to participants to ask questions, and then you can also, additions, clarifications, and all that. Thank you. I don't know, do we have parents in the house or caregivers of children with caregivers of individuals with ADHD, ASD, neurodivergent individuals? And if anybody wants to talk to us about any particular challenge and how you were able to navigate that challenge. So while we are waiting for other questions, I mean, additions and all of that, let me also quickly mention that, I mean, apart from what Mr. Olumide has said, the other thing about technology and apps is that there are certain apps like Social Express, Avers, which people use to reinforce skills through interactive learning, where a child will just, log on to a particular app, open it, and whatever they are seeing on the app can help them, and that can go a long way in reinforcing whatever interactive learning skills we want them to learn. Then I could remember there was a time even Can Do in collaboration with some other bodies was working on a particular app that helps caregivers themselves to, log on to a particular app, put in the signs and symptoms on the child, and they can actually diagnose this whatever disorder themselves. I mean, and you don't need anything to do that. All you need to do is get the app downloaded on your phone and you can arrive at something logical yourself. You don't have to be a doctor, you don't have to be a nurse, you don't have to be anything to get that done. Let me also mention that apart from all of these things that we have talked about, some people make use of facilitators, especially in a learning environment, especially in schools, when they have to attend mainstream schools where they may have difficulty coping with the speed at which the other children speak, difficulty with communication, difficulty with interaction, and all of that, where a facilitator can actually gradually, help them cope with whatever social situation. So I would say that improving social skills in children with autism, neurodevelopmental disorders, ADHD, and all of that, neurodivergent individuals goes. It's a topic that we cannot. I mean, if we continue to talk about this till tomorrow, we have a lot of things to talk about. I mean, I would say that structured social skill training in form of social stories, role playing, video modeling, and Mr. Okewo, if you agree with me, today we looked at the role of play alone. And if we have to talk about the role of play in improving social skills in children with neurodevelopmental disorders, it goes a long way. Do you agree with me?
Yes,
Play
I do.
alone, yes, it goes a long way. It improves skills in many areas. I mean, just play your interaction with your child. What are the things that you can do from, social interaction? You get a toy, another toy for yourself, and you allow your child to play with that particular toy in a positive way. You pay attention to the details, you try to talk to them, you are doing something, you're explaining what you are doing, you're trying to catch their attention, and all of that. So this topic can never be overflowed. So I'll say that that alone, I mean, we can look at that some other times and it can be our topic for the day. Then apart from that, therapy and interventions from medical team, applied behavioral analyst, speech and language therapist, occupational therapist, and all of that. The psychiatrist, the psychologist. And apart from that, of course, there's also peer interaction opportunities in form of play dates and small group activities where you can pull neurodivergent individuals together and they learn from one another. Controlled settings with guided support, social skill group, parental and teacher support in forms of modeling and coaching. Adults demonstrate appropriate behavior and coach children in real time, like in form of play that I've discussed, the role of positive reinforcement. When they do something good, you praise them, you give them reward for bad behavior, you might just turn away, not necessarily scolding them for what they have done wrong. Consistency across environments, coordinate within home, school, and therapy for uniform support, use of visual support, visual schedules, emotion charts. You have a chart that shows emotion, you're happy, you're sad, you're anxious, and all of that. This goes a long way to help them. And lastly, the use of technology and apps. All of these are very important in improving social skills in neurodivergent individuals. So I pause again and I leave the room open for others to also contribute. Then apart from this, there's a message on the chat. I want you to drop your emails so that we can send you a short survey. After this meeting, we'd like to get a feedback from you, please. Thank you. The floor is open for questions, clarifications, or you want to share your experience. We have in the house Mrs. Ganiat Abiodun Adedayo. Can you please introduce yourself? Hello? I can also see Mr. Yinka Oyegbile. Can you please introduce yourself to us?
Dr. Adegbite, let me jump in and introduce myself. My name is Shola Fatoba. I'm the mom of two neurodivergent children. I have an 11-year-old and an 8-year-old. So this topic is very relevant for me specifically because both my kids are nonverbal. But over the years, they've come to acquire some level of speech, but definitely are able to communicate a lot more. So I just wanted to concur with what you shared with Dr. Okeo as well, regarding play, how important play is, because it's been a method that we have used to just sort of teach them basic skills. So we make, daily activities a game. Sometimes, we use pictorials. And, there was something that Mr. Okeo mentioned also about, when they cry to communicate what they want, just learning to hold back and giving them the opportunity to, use communication skills. So if for example, my son wants a cookie at some point, he cries, it becomes a teaching moment where the cookie is sitting there on a jar where he can't reach it. He's going to cry for several days, but I'm going to keep reminding him to say, give me cookie, and over time, I mean, they're both able to acquire basic verbal language of give me, let's go, very simple languages, but a lot further from where we started. Also, picture identification has been superb for us. So thank you very much again. This has been super helpful. Thank you.
Thank you, Mrs. Fatoba, for that contribution. I mean, honestly, if you look at play alone, I mean, on one of our support group meetings, we can just look at the role of play in improving social skills in children with autism spectrum disorder, it goes a long way. And of course, many of the times parents don't even know what to do. Sometimes when they know what to do, they're not patient enough to allow these children learn properly. I mean, there are a lot of challenges, there are a lot of issues, and even now that we're discussing some of these things, a lot of parents are not here to even get to hear or learn the new things we're discussing here. Many of the times they believe in bringing them to the hospital, they want the doctor to prescribe medication, but many of these issues can never be solved with medication. Many of them are actually behavioral in nature, and we need behavioral modification in solving some of these problems. So thank you for that contribution once again.
Hello.
Hello.
Hello. Hello. Good
Hello, we
evening.
are here. We can hear you.
I'm a she. This is Yinka Oyegbile on the line.
Okay, you're welcome, ma.
Can you hear me?
Yes, we can hear you. Loud
Okay.
and clear.
I'm Yinka Oyegbile. Yes. Thank you, our speaker. God bless you. I just want to add
Thank you.
to what the speaker said. My son, most time he doesn't want to talk. He prefers to sing. And what I've learned is that when you sing, even he picks that faster than when you speak to him. I don't think if you understand what I'm trying to say.
Yes, we do.
We do.
Okay. If I say, tell me your name now, and I repeat the name after him, he may not answer. But when I make it in the form of a song, you understand? You say it after me. So that's at times as a form of learning or teaching him. Another thing I do is that maybe I will say pick a cup. By the time I'm saying pick a cup, I'm putting action as well into it, so that you'll be able to relate that statement with the action that I want him to learn and do. Those are the two things I can add to that. Thank you, Mas. Thank you.
Thank you so very much, ma, for that contribution. I'll still say that it boils down to, apart from the singing aspect of it, the role play is still very critical in improving social skills of people with neurodevelopmental disorders. Thank you so much, ma. Please drop your email on the chat so that we can send you our survey questions for feedback.
Okay,
Thank you, ma. Are there other
welcome.
contributions? Thank you. Other contributions, questions? So we have about 2 minutes to go. Questions, contributions. Dr. Obiao, do you want to add anything?
Good evening, man. No, man. It was a nice presentation.
Thank you. Thank you so very much, Mr. Okeowo. Thank you, Mrs. Fatoba. Thank you, Mrs. Adeduga. Mrs. Ganiat Abiodun, we didn't hear your voice. Mrs. Yinka Oyegbile, thank you for your contribution. Mr. Okeowo, thank you. I know it has been a very busy day for you, but even at that, yes, you still created time for us. May God bless you. Thank you so very much.
Amen.
Thank you, everybody. Our support group meetings comes up every third Thursday of the month. It's usually a virtual meeting, and it's usually a virtual meeting at 7 p.m. to 8 p.m. every third Thursday of the month. So we are hoping that as time goes on, we'll have more people joining us. But I must say big thank you to everybody. Bloombody, may God bless you. Thank you, everyone. I think we can bring the meeting to a close if there are no other additions. Thank you.
Thank you, Dr. Adegbita.
Thank you.